Hi, this is Group 12. Our assignment was tort reform in the healthcare industry. Um, I am Rachel Scott, and we also have Camilla Fisk, Taylor Mon, and Christian Keddington with us. So our first slide, our first question was, what is tort? So what it is in law, any wrong or injury. Torts are injuries done to the person or property of another as trespass, assault, and battery, defamation, and the like. So tort reform would be refers to laws passed on a state-by-state basis, which place limits or caps on the type or amount of damages that may be awarded in personal injury lawsuits. The next question was, is it necessary? Do we absolutely have to have it? And there's two sides to this. There's those who are in favor and those who aren't. Those who are in favor, they feel like it's necessary to fix certain problems in personal injury law and similar tort cases. These problems include courts that are overrun with personal injury cases, cases that are brought too late after the injury to figure out what happened, and cases in which injuries give especially large damage amounts to plaintiffs, which is a person who brings a case against another in a court of law. Those who advocate tort reform argue that limitations or caps need to be placed on damages able to be recovered in lawsuits because excessive damage awards create an oppressive tax on the cost of doing business. Advocates of tort reform attribute high cost of certain products or services to be due in part to litigation costs, which are just litigation being the process of taking legal action, so just the costs with that. So what does this all mean in layman's terms? It's basically those who think it's necessary, advocates, think that charging more costs for injuries is necessary to handle the cost of potential legal matters with these issues, that paying this extra money is necessary. And then the other side of it are those who are opposed. So this group argues that such cap or limits on damages are arbitrary, or meaning it's based on random choice or personal whim rather than on any reason or system, and that damages need to be assessed on a case-by-case basis because a blanket approach is unfair to severely injured plaintiffs. Opponents also argue that tort reform measures won't prevent insurance rate hikes. So, in a nutshell, those who are opposed to tort reform feel that each injury case needs to be handled and dealt with on a case-by-case basis, and having a one-size-fits-all rule for everyone isn't fair. For example, if you had case A, may only require a certain amount of money awarded for whatever reason, but case B may not be justified in getting any money. And this is okay. Not every case needs to have a lot of money or really any money. Depends on circumstances. So don't give money to case B just for the sake of giving money away. Hence the need to save money in the healthcare system and with taxes overall so that money isn't being spent unnecessarily. The proposed ideas to fix tort reform vary considerably, but most focus on either limiting tort lawsuits or limiting the amount of compensation available if a tort lawsuit succeeds.
So now we're looking at the specific example of tort reform in Texas. The reform took effect on September 1st of 2003. So Texas has often been referred to as the tort reform state because so many legislative efforts have been made to incorporate tort reform into the state law. Texas has explicitly focused on putting limits on monetary damages for medical malpractice claims. So this essentially means that doctors are protected from claims where patients are they want a lot of money for minor injuries. There are a few really unique parts of Texas's tort laws. The first one is no statutory damages. So this means that plaintiffs have to prove that there was a substantial economic loss before any awards can be rewarded for their damages. And then there's the Texas Tort Claims Act. So usually individuals can't file private lawsuits against a government entity because of sovereign immunity. So the Claims Act removes sovereign immunity and gives those individuals the ability to file private suits. Then there is the Texas Advanced Directives Act. This protects physicians from liability suits when they choose to discontinue treatment on a critically ill patient. So 10 days after a written notice that a treatment won't be effective on the patient, physicians are able to remove treatment and remain protected under the Advanced Directives Act. And then the final unique part is comparative negligence. So this means that the liability must be equal to or less than 50% in order for plaintiffs to recover damages. And this is in regards to negligence claims. So what has tort reform done for Texas? The last point on what tort reform has done for Texas. So the number of physician licenses does not reflect the number of physicians that have left the state or have retired. So basically, tort reform is not really affecting the number of physicians that want to move to Texas, and this may possibly be due to the fact that there is a booming population in Texas and more job openings, but essentially it hasn't affected the number of physicians.
All right, so tort reform and ObamaCare. Just so we're all on the same page, ObamaCare is the informal term for the Affordable Care Act, and that is just the mandate that was made to improve the health care in the United States. So President Obama would not allow tort reform to be included in the 2009-2010 debates on health care reform, which became Obamacare. Obama told the American Medical Association, or the AMA, that he would not advocate caps on any malpractice awards. He said it would be unfair to those who have been wrongfully harmed. Obama was asked in an interview, would you be willing to do more in the area of tort reform and malpractice insurance? Would you be willing to agree to caps, for example, on malpractice judgments? And he replied, what I would be willing to do is consider any ideas out there that would actually work in terms of reducing costs, improving the quality of patient care. So far, the evidence I've seen is that caps will not do this.
So did anything change? While Obama hints at the fact of changing things to regards to tort reform, nothing really happens. In the same interview that we just barely quoted from 60 Minutes, it states that he is so far not willing to consider capping malpractice judgments, a reform proposal consistently put forward by the Republican Party. So President Obama himself then goes on to say, many in this chamber, particularly on the Republican side of the aisle, have long insisted that reforming our medical malpractice laws can help bring down the cost of health care. The President said last Wednesday to a joint session of Congress, now I don't believe malpractice reform is a silver bullet, but I've talked to enough doctors to know that defensive medicine may be contributing to unnecessary costs. So since the President was unable to come to an agreement on putting a cap on malpractice, things didn't change in the Obama administration. Things that there is still no cap to how much a civilian may sue. They may sue as much as they can for malpractice. This may be a reason why so many doctors are still in the defensive medicine way of thinking, where doctors continue to have as many tests run on their patients to cover their end so they may not get sued for these uncapped amounts of money. Whether putting a cap on the tort reform would lower the cost of medical practice is uncertain, but we wouldn't know unless we tried.